Hi, Selena. Thanks a lot for the introduction. I'm really happy to be here, talking to all of you. As Dr. Ho mentioned, so I'm one of those kind of people who I don't have a APC, and so I'm one of those kind of doctors who I didn't get to go into housemanship, and I'll talk a little bit about that through the presentation, and what I've been doing so far since I graduated from med school. I'm just gonna share my slide. I have a slide up. And then this particular slide is a slideshow that I shared with the US Department of State. There's a program called the Community Solutions Program. Back in 2018, I used this presentation to show the kind of work that I was doing when I was still in medical school. And I thought it would be really interesting to share with you. And I hope you guys take something away from this presentation. Let me just get it up. Yeah, I hope you guys can see the slideshow. Selena, could I just check with you? Is everything okay?
Yep, everything's good.
Awesome. So, I was trying to name my slideshow and I didn't know what to call it. And I thought, luckily would be a good sort of title because, when I graduated medical school, I wanted to go into housemanship and I applied. But I was rejected, and the reason why I was rejected is simply because so I did high school, I did IGCSE, and then I went on to do A levels, and so I never did SPM. And then when I came back, there was this new rule where in order to get a position as a house officer, I need to have SPM, and then later it was further reduced down to Bahasa. But at that time, because I graduated at the end of 2017, so I came back, I was stuck. I applied, my application was rejected. I wanted to sit for the SPM in 2018, but I ended up in the States at the time and the timing was just not right. And so I never was able to get into sort of the clinical setting here in Malaysia. This is the particular slideshow that I shared with the Community Solutions Program fellows. About 97 fellows from over 60 plus countries. We all gathered in the States and we spent about 4 months there working with nonprofits based in the States. And I was kind of working with a refugee resettlement agency based out of Nashville. And my role was to develop health screening protocols for new American families. And so there are a lot of people who had just gotten their green card or their citizenship in America and had moved over and they needed to have a screening protocol. And I was there sort of helping to develop that particular program. Oops, yeah, okay. So a little bit background about myself. So I did my MBBS in Bangladesh. Chittagong Medical College is my alma mater. I graduated at the end of 2017. I'm currently working with Cancer Research Malaysia. My role is a donor engagement manager. And so basically what that entails is me sort of talking to people, the general public, and sort of finding ways to engage with new donors to get them interested in supporting cancer research. Cancer Research Malaysia is the only organization that's in Malaysia that's focused very specifically on cancer research and utilizing this particular data for impactful treatment and interventions. So it's very interesting. You can go into the website cancerresearch.my and you can read up all about the science behind it. Prof. Teo, who is the Chief Scientific Officer for us, has even gotten an OBE from Queen Elizabeth. And the whole science team, all the scientists are doing lots of work in the field of genetic research as well as immunotherapy and many other things. A lot of science there. I won't go too much into it. If you're interested, you can always write to me, write to the organization, check out our website. So also in the slide, you can see there, I mentioned a little bit about the Community Solutions Program. And the reason why I was sort of selected to go for the Community Solutions Program is because of the work that I did back in medical school. So in my third year of medical school in Bangladesh, I saw an opportunity. The opportunity was to start a program that would allow doctors based out of my hospital to go out into the field and interact with communities. The idea came out pretty much because we were in the hospital and we were seeing that a lot of patients were coming very late at the end stages of disease. And we wanted to start a project that could sort of impact at the grassroots level. So we wanted to use healthcare as a tool for community engagement and community empowerment. I started this sort of like in third year medical school just as an experiment. And the results that we got out of the program were really amazing. And so that led to further expansion and many other things, which I will show later as the slides go through. So through the whole process, I was also appointed as the country director for Magical Light Foundation. Magical Light Foundation is based out of Singapore. They work for development of and empowerment of vulnerable communities all across Asia. So that includes healthcare, education, when there are natural disasters, so emergency aid, relief support, all these kind of things. So you can check them out as well. I'll have the links at the end of this presentation, so you can go ahead and look at all of these organizations. I also am an advisory mentor to the Queen's Young Leaders and an associate fellow of the RCS. Just this year, I've taken up a position as the co-lead for the YCLE Young Professionals Chronic Disease Network. So there's a network and we just started up the ASEAN sort of chapter of the whole thing. And so I'm part of that chapter. I'm co-leading it with another doctor from the Philippines. And also this year, the US Embassy sort of linked us to a US funded program called the US ASEAN Health Futures Alumni Network. And so I'm part of that as well. We are sort of pulling together all our resources and all the sort of information and knowledge that we have to address community healthcare issues. At the bottom there, I have this small thing that I mentioned. So in medical school, when I was in the 5th year of medical school, I published a book. In the corner there, you can see. So it's a translation of English to Bangla, all the questions and commands that we use for general examination in the hospital. The reason why I had to publish this particular book was because there was no such material available. So for foreign medical students and foreign doctors who were going into Bangladesh, when they need to communicate with patients, it's very difficult because the language, there's a lot of language barriers. So the written Bangla is not the same as the spoken, and there are also many different dialects. And so in Chittagong, we needed sort of a guide. And I had some notes through my 5 years of medical school there, 6 years of medical school. And so we sort of compiled all those and expanded and published the book so that now this particular book is the standard for medical students going into Bangladesh as well as doctors. So a little bit about community empowerment. I think we know that community empowerment is sort of like not us going in and treating a community as a bag of needs, but rather us going into the community and assisting the community to become self-sustaining, to give them the tools that they need to be able to develop and improve their lives. And this is very important because a lot of the charities, when we think of charity, we always think about, oh, you know, let's go give them something, give them food, give them rice. But this is not sustainable. This is a feel-good thing. We go out to a poor village and we say, oh, you know, you guys need toilets, and then we build you toilets. But that's not the solution. The solution actually has to come from the grassroots. And so we take a very different approach. We actually go into the communities and we talk to them, and then we involve them in the whole process and get ideas or specific solutions for specific problems that are localized. And this is very important and very sustainable. So my journey began about 7 years ago in the nonprofit sector. I was in my hospital, and this is a picture of the hospital, my medical college. And you can see that there's like, you know, 2 beds and there's another bed in between those 2 beds. So there's a patient who actually has to sleep on the floor. And if you look at this picture, it's a big mess, a lot of people in the ward. This is one of the better wards. Some of the wards are even more crowded and have more patients than this. This was a winter, and this was a very cold winter for me. The coldest winter I think that I've experienced. And I was just sitting with my, you know, there's a bunch of us Malaysian friends there, and we were just talking to ourselves, and, you know, we thought, wow, it's really cold. You know, what about the poor people on the streets? You know, we see a lot of poor people every day. What about them? And so I did a little bit of photography back then. And one day I saw this poster somewhere and it said, looking for volunteers, please volunteer, come and, help us as we fight against winter. And that really caught my attention because it was cold. And I wanted to do some photography and I said, hey, this is a good opportunity. Let me go in, take some pictures. And I went out and these are some of the pictures that we took from the slum areas. One of the volunteer found out that I was a medical student. And he came up to me and he asked me this question and he said, why are you taking pictures? You can do more. And that was sort of an idea that got planted in my head. And that sort of led me to think about, doing more than just going in and volunteering as a photographer. Other people can volunteer to be a photographer. This particular picture of me is with Teddy Mobile Clinic. So if you guys haven't heard of Teddy Mobile Clinic, it's this organization that's based here in the Klang Valley. They do a mobile clinic every week in 2 locations. One is in the transit home opposite HKL, and one is in front of Segi College in KL every Wednesday night for the homeless people and for urban poor. So right now with the coronavirus situation, the mobile clinic is sort of stopped. But when the new normal comes and when things are relaxed a little bit, I hope that many of you can volunteer your time at Teddy Mobile Clinic. It's an amazing place to get some experience and meet other doctors as well who are very passionate about working with marginalized communities. And Teddy Mobile Clinic needs help. So whenever you're free, do reach out to them. They have a Facebook page. You can sign up to volunteer. Even if you're a fresh graduate with no medical experience, no clinical experience in Malaysia, there are always senior doctors following the SOPs to sort of guide you. You can help. There's a lot of things that you need help with. So back to the story. So like, the guy, he said this thing and it was an idea that was stuck in my head. And I used the quote from Inception, a really good idea, once it's in your head, it's there, and you become obsessed about it and you can't really get rid of it. So I said, okay, this particular picture is a bunch of us. All of us are Malaysian in this photo. 8 of us decided, hey, that was a good idea. Why don't we go and we do a health checkup for these people? And we went there with our lab coat and our stethoscope and decided, okay, hey, we're doing, health checkup. But none of us were doctors. And so we couldn't write any prescriptions. And then most of the patients who came to that medical camp, they thought we were doctors and they were sick and we couldn't do anything. So at the end of the day, all of us went home and we said, actually, we didn't do anything. We didn't make any impact. We just went there. They took some nice pictures of us. But in reality, every sick patient, we just told them, go to the hospital. We didn't help, didn't do anything. So that sort of idea, we decided to improve on it. We expanded and we ended up launching this program called medical camps. So this is an example of one of the medical camps that we did. We sort of integrate services. So of course, the first time we did it, we didn't have doctors. So the first thing was, okay, we need to bring doctors. But then we realized, bringing doctors, writing a prescription is not enough. We need to do medication, we need to do other things as well. So I'll just run through a couple of the pictures on the slides. This is one of my, colleagues. He was a doctor. He came, volunteered, doing the checkup, outpatient. We also started to bring in medical students to help with the pharmacy. So if you look at this photo, you can see there's a whole bunch of boxes. There was our medication stock, and we actually have a whole bunch of people sort of helping to manage dispensing medication. And then we work with a lot of other specialized organizations. So for example, Lions Eye Hospital would come in to do an eye checkup. And then we would also focus on campaigns like deworming and multivitamin supplementation. And also work with the schools. So there are a lot of free schools or NGO schools targeted at underprivileged students. And we sort of work with the school to come up with a system so that they can track the BMI of these kids and intervene should there be any deviation from a normal growth pattern. We also work with physiotherapists. So physiotherapists come in, and if, let's say, we know in that particular area there's a high number of elderly people or senior people, and they are interested in having a physiotherapist come in and talk to them about certain maneuvers that they can do, we reach out to our partners, our physiotherapists. And then, of course, because it's a clinic, so you have lots of patients waiting to see the doctor. They're sitting around, nothing to do. So we started to do health education for them while they're waiting. So one of the issues that we targeted was female hygiene and also menstruation, because this is a very taboo subject. It's very that nobody seems to be talking about in Bangladesh. So this is one of the things that we focused on. And then we also got the dentist to come in and participate and get the kids to brush their teeth, on the pretense that we'll give them a reward for the winner. But in the end, everyone would get a prize for participating. So washing hands, very practical. We have to do it with them hands-on. Because one of the things that we notice is that 40% of the patients who come are illiterate. And so we have to sort of cater for them. And the way that we do that is by hands-on practical experience. And that sort of helps with the transfer of knowledge from us to these communities. And this is me doing basic life support training for the lifeguards. So the longest beach in the world is actually in Bangladesh. It's called Cox's Bazar, which is where the refugees, the Rohingya refugees, the refugee camp is right now. And they didn't have a lifeguard, they didn't have lifeguards on that beach for a very, very long time. And just a couple of years ago, they started up the lifeguard project. And I was there on holiday once and I met with the lifeguards. And they were telling me they don't have the necessary equipment to sort of respond to a near drowning. And so our organization, Magical Light, was able to fund sort of the equipment for them to respond. And so we went in, we did some training for them, how to use the equipment and things like that. So over the years, our impact, we have treated about 3,600 patients through this program, outpatient. We also help them, refer them to Medical College Hospital, and then help them to access funds if they need surgery or further treatment. Along the way, I was also able to work with a local project. We actually built a school in one of the railway slums very near a hospital. The school initially had 40 students in a very small rented tin shack. And we sort of worked to build and expand the school, which now has 166 students. Classes go 6 days a week in 2 shifts, things like that. So these are some examples of the opportunities that came up in Bangladesh. It was very interesting. And then, of course, because there are a lot of natural disasters as well, and when natural disasters hit, we have to deploy. And so we've done disaster relief. I'll just maybe run through very quickly. So there's cyclones, floods, even the Nepal earthquake. Some of the medical students and doctors in my hospital were from Nepal. And so when they went back, when the earthquake hit, they wanted to go back to their country to help the people. And so we worked with them to sort of equip them. And they actually went to Sindupal Chowk district. They were the first medical team to get into that area. So one of the principles that we have is we want to go to an area where nobody else is going for whatever reason. And so they picked an area that nobody had gone to before at that time, and they went there. And if you look in the picture on the left, on the top, that's where they did the outpatient. And they actually built those tents out of tarp, and they stayed there for a week. They camped out for a week, and they treated patients, almost 1,000 patients in that 1 week alone. And most recently in Lombok, there was an earthquake, a tsunami, and the schools were sort of, disrupted. They needed to build temporary schools. The Magical Life Foundation went in to build schools in Lombok, about 30 or 40 schools. And this particular connection was quite interesting because I was in the States at that time, and I had met a fellow, previous alumni, and he was from Lombok as well. And then the disaster hit, and I was able to sort of link him to our organization so that we could work in partnership and do something impactful. So a little bit about the medical camps, the SOP, what we use. In general, we have resources, and so our resources sort of on top here, these are the funding sources. We get our funding from grants, we get our funding from parent charities, we get our funding from philanthropists who want to contribute. And then if you look at the yellow circles, those are basically our manpower resources, our physical resources. We have doctors, medical students, nurses, auxiliary volunteers who come in to help as well. And then at the bottom, we have pharmaceutical companies and also other like-minded organizations. And this is basically all the moving parts of a medical camp or getting such a project to run. And then the SOP for patient flow is pretty simple. We have, the registration and the consultation and the pharmacy, but we have an additional step here, which is we got medical students, volunteers, to actually explain and go through each of the drugs after they have been dispensed to the patient, because many of these patients have never ever seen a doctor before coming to our medical camps, and then they don't know how to read, the prescription, and so the volunteers actually help them to sort of understand the prescription. And then, of course, additional services, like I mentioned before. Behind the scenes of doing such a project or such a mobile clinic or medical camp, of course, we always have to think about emergency evacuation and crowd control. These are two very, very important aspects because, when you go into a marginalized or vulnerable community, we think like, oh, they'll be very sort of overjoyed to see us and they'll be like, oh, thank you, doctor, for coming. You saved our life. That's not always the case. We have to think of contingency plans in case something goes wrong. Lots of things to consider, depending on, of course, the area that we're going to. And then, of course, health education and awareness. I talked about it a little bit before. We do the brushing the teeth thing, washing hands, and then, showing them physical samples of a sanitary pad, things like that. This is a picture of the school that we built. We have 166 kids there. It's sustainable. The school has been running. It's been growing very well. We're very pleased about the results that have come out. So these are a bunch of links here. So I think if you want to screenshot them, you can have a screenshot on this. You can also write to me. My email's down there. My Facebook page is there as well. Do check them out. They're quite interesting. So the M Exchange is the project that I started in Bangladesh. And Magical Life Foundation is based out of Singapore. Teddy Mobile Clinic is based here in Klang Valley. So for those of you who are in Klang, want to do something, that's the best bet. And our school even has a Facebook page as well. But most of the posts are in Bangla. So yeah, you can go and check it out. Look at the pictures if you're interested. Cancer Research Malaysia, a plug in here. Lots of interesting stuff going on. If you're interested in research, please do check us out. Please write to me. We can always, share stuff with you. It'd be really interesting. Most interestingly, I just got accepted into the Erasmus Mundus Joint Master Degree Program for Public Health and Disasters. So I'm supposed to be heading over to Spain in somewhere in September, together with another Malaysian doctor from USM, Dr. Rick. So hopefully that opens up doors to new sort of adventures. I think Selena has given me a bunch of questions, prompts. Maybe we'd like to talk about it. But I think maybe we can go into the questions if there are any other questions and I can talk about it. Selena?
Okay, there's one question from Imran. He wants to know, what do you think the best approach is to research-based career pathway working under NGO or NPOs? Does CRM still have any job opening slots currently?
That's a good question. So for me currently, I'm not in the research field. There are opportunities to be involved in research. There are doctors, even like Selena, who have gone into research. I'm not working in research. I'm working more with engagement and community empowerment and things like that. But there definitely are opportunities. And if you're interested, that's your thing. You should definitely check it out. Try to find some opportunities.
Okay, to Imran, actually Dr. Ho, he has done research before and he has a vast network of people he knows. So I've already shared his email in the web chat. So if you have anything to ask regarding research, actually you can just drop Dr. Ho a message, drop him an email. It's at tellime.malaysia@gmail.com or hoiclinic@yahoo.co.uk. So maybe he would be a better person or he could direct you to somebody who knows more about this research field. Yeah. Maybe Collins, you can share, how did you get the Erasmus Mundus master's degree? I mean, what were they looking for? How did you get yourself into the program? Because it sounds like it's not for everybody, and they must have picked. I mean, what were they looking for? Yeah.
Sure. So because of the work that I was doing in Bangladesh, I was involved with a lot of these medical clinics, these mobile clinics and medical camps was sort of, as you saw in the presentation, a bunch of them were done in response to natural disasters. And so it's with that and the experience that we've been generating out of Bangladesh that I applied for this Erasmus Mundus program. I was really interested in it because I'm particularly interested in disaster relief. And so that was something that I wanted to pursue. I was very lucky. I came across this scholarship opportunity and I applied and I got it. I also tried for other scholarship opportunity as well. So there's the Queen's scholarships, there's the Commonwealth scholarships, but this was the one that sort of I was really interested in it, and somehow I got it. So.
Okay. All right. There's another question. Dr. Collins, can you share what are the possible sources of income while doing volunteer work?
Okay, so that's very difficult, yes. And that's something that I personally struggle with a lot. So if you're going into nonprofits, if you're going into sort of volunteer work, you need to expect that there's no money for volunteers. So you can earn enough money to cover your expenses, but you're not going to get rich off volunteering, going into, field and treating patients under such conditions. For me, that was something I did on the side and sort of like a project, not really a career choice. It's very limited now. But we're kind of hoping that as things pass, as time goes on, my goal is to develop a sort of a platform that can be sustainable in nature. And that involves us, of course, definitely paying the staff, because without having full-time staff, without having a payroll system, sort of these programs are not sustainable. So they come, they start, they stop, and that doesn't have any continuity. And ideally, we want something that's truly sustainable. I just thought of something very quickly. So in 2019, I actually went back to Bangladesh and I worked with a Japanese startup company based out of the University of Tokyo. It's called MIAP. And they are actually developing artificial intelligence for a symptom checker. And so the University of Tokyo started up this sort of very small startup company in Bangladesh, and they utilize artificial intelligence. They collect data from patients who go in for full body health checkups, and they're working on it. And I worked as the business development manager for that. So I think there are a lot of careers in the healthcare field that are not necessarily clinical. So as a physician, like Dr. Ho mentioned, the aunties telling you, oh, you studied, you became a doctor. Then I asked, so waste lah, you never see patient. It's understandable because, the general public, when they think doctor, it's always, when have you seen a doctor? Like the only time you see a doctor is when you're sick, then you go to clinical, then you see a doctor, right? So everyone's like, oh, doctor, clinical. But there are a lot of other jobs in the healthcare industry that require doctors. Like business development is one, community engagement is another. Like Dr. Ho mentioned as well, doing your master's in business administration for entrepreneurship. And I think now with the whole coronavirus situation, digital healthcare is the next big thing, because, the classical sort of system where you go to the hospital to see a doctor, you wait a long time, may not be so feasible anymore. The risk may not be worth it anymore. And so a lot of new things have to be developed. And the artificial intelligence company that I was working with in Bangladesh, they were also looking at telemedicine and telehealth. There are, of course, a lot of logistical issues with implementing such a program. But I think as the new normal comes, as things change, we have to adapt as well. Well, please write to me. I've done a lot of stuff. So I've done medical writing as well. I wrote for, ophthalmology. I pretty much tried a whole bunch of things. So if you're interested, please do write to me. The two things I haven't tried, I haven't gone into insurance, and I have never done pharmaceuticals. This is out of a personal choice. I did consider, but I never ended up entering those fields.